Hey everyone, so I just finished up my interview with Joe Sigfried, who's a myofunctional therapist. I've been doing myofunctional therapy with him for the past month, 2 months, and been seeing great results. And quite frankly, I don't know why more people don't know about it, so that's why I wanted to do this video. We're going to talk about what myofunctional therapy is and if you can benefit from it, so please enjoy.
Like I said, like I really just wanted to get you on this call to really explain what myofunctional therapy is for people who don't know about it. Because like we know, I've been doing myofunctional therapy along with Dr. Estrobulo's treatment. And like I was just explaining to you, like there really have been a lot of benefits for me in terms of just my tongue feels like it's just pretty much glued to my mouth. I've been sleeping with my mouth closed. My breathing has improved. And I think for anybody who's trying to do mewing on this channel or trying to improve their tongue posture, I think that they should definitely know what myofunctional therapy is. So that's why I wanted to do this interview or just this conversation with you so we could just kind of talk about what myofunctional therapy is. I have the theory, honestly, that most people should be doing it, or sorry, could be doing it. I mean, it's
Mhm.
something that could help them. And a lot of people don't know about it. So that's why I just wanted to do this video with you to help people understand what it is. So yeah, thank you.
No problem. So from my perspective, myofunctional therapy has a few main goals. Ideally getting a proper oral rest position, which is tongue on the roof of your mouth at all times, okay, during
Yeah,
rest. And what that is almost a passive suction, a nice flat passive suction on the roof of your mouth.
got it.
Um, Along with that, myofunctional therapy goals are to improve a lip seal, so to correct any kind of lip competency issue. So
Yeah,
commonly amongst mouth breathers or people who have poor oral rest position,
yeah,
commonly there's a lip competency issue,
right.
meaning aren't strong enough to stay closed because they've been
Mm-hmm.
compensating for so long. And then another goal is to ideally improve swallow and chew patterns. Okay.
Got it.
So commonly, people who have poor oral rest positions can actually have something called a tongue thrust. So during a swallow pattern, they'll thrust and brace against their teeth and
Right.
use a lot of their lips
Yeah,
to help and their neck to help them swallow. So ideally, myofunctional therapy, the goals of that are to improve that swallow and chew pattern as well. As an adjunct to it, all of that combined improves nasal breathing patterns.
yeah, and it all kind of works together. So that's
Yes,
that's kind of what is, and I hearing you say that, I realize it's hard to describe in kind of one sentence what myofunctional therapy is.
it is.
So just like what you said, like improve the tongue suction, which, like, when you think about tongue posture, really in an ideal scenario, right, you do have that suction hold where it's up against your upper palate.
Mhm.
And I've heard people in Mewing and Dr. Mike Mew talk about that as well. But so you call that the suction hold.
It's like a passive suction. It shouldn't be a lot of work
Right. And
for you.
I've noticed, that's what I've noticed. I've noticed that that's happening with me. And it's a good feeling because it just, like, without trying, essentially everything becomes easier and your airway becomes better, which we'll get into. Like, we could make this video super long and I don't want to drag it out too much. So I'm trying to be somewhat organized with it.
Yep.
But so, like you said, the tongue suction, the lip seal, and then the swallowing pattern, which is more about like the functions of your tongue, right?
Exactly. Myofunctional therapy is all about function and
Got it.
having all of the muscles in the face and ideally the tongue
Yeah,
functioning ideally.
got it.
So those are
So
essential. Sorry, go ahead.
yeah, sorry to interrupt. Okay, so lip seal. So me, I've noticed my lip seal improve a lot, which has helped me to breathe through my nose at night. I've also noticed the tongue suction thing. So now that we've outlined those kind of goals, like how do we go about achieving those? Like what is it that you actually do with your patients?
So with my
And
clients, I generally do, it's, I don't like to call it an exercise program, but there are exercises that are given for each client every week, and it's based on progress. I was originally taught sort of a cookie cutter every week. Every client does these exercises. It's I learned very quickly that that doesn't necessarily work for everybody. But essentially, it's a series of exercises that are focused on that client and that client's needs and that client's progress. So essentially, a lot of them, and each exercise complements each other. Some are with props, some are without, but most of it is based on building strength, improving the articulation of the actual tongue itself, and then creating a muscle memory process to help it function in a normal pattern.
That's super interesting. Yeah. Because I didn't even think of it like that. The way that I think of it is like you're strengthening your tongue and your lips and your cheeks, which you are, right?
Yes.
But
But
then,
each exercise and each, as I said, everybody's different, but the exercises are designed in a way to promote um, something specific to a swallow articulation and strength building. So, and then in turn, over time, as it becomes generalized, as the brain and the muscles start to work together, as it becomes generalized, it no longer becomes work. It takes time. It's not just snap and your tongue's living on the roof of your mouth. But as you build, so for example, as you build strength in the tongue itself using a certain type of exercise, it's easier to have it live on the roof of your mouth because it has more of an ability to do that.
yeah, and it's kind of like working out in a way, right? Because it's like
Absolutely.
if I do like a bicep curl for my then that muscle is stronger a week from now than it was when I did that exercise.
So then it's easier to do the bicep curl.
Right. Totally. Yeah, I get it.
Yeah.
And again, I've noticed that, and I'd love to share on this channel more about the benefits that I've noticed from this. But basically what I noticed is my tongue is just up and forwards more so than it was before, which is making it easier to breathe, easier to keep my mouth closed, easier to swallow, everything you said.
Yeah.
So, yeah.
Yeah, as that suction and as it becomes more generalized and you don't have to think about it, you the work that the neck has to do to help swallow, or the work that the jaw has to do to help keep that mouth closed, it lessens that. So really the tongue is doing most of the work, and your tongue lives on the roof of your mouth, and your jaw just kind of hangs from there, and it's a sort of more of an ideal rest position.
Yeah, got you. So now I want to talk about mewing, because that's what a lot of people that are, on this channel and online kind of understand. And when I hear people talking about mewing, I often think that there's a lot more that you can do to make those kind of improvements. So I know that I just basically asked you to look up what mewing is to so you could kind of get a bit caught up on it.
For sure.
But the way that I think about mewing is I think about it as having proper tongue posture, having proper oral posture for the majority of the day, which over time is going to hopefully cause some changes to people's health, some changes to people's facial structure and the way that their features look. So that's kind of how I think, and I think how most of the community thinks about mewing and tongue posture. How do you kind of see it in terms of how it fits into what you do?
So while I have limited experience with mewing, obviously, my understanding is that the goals are the same. And for ideal oral rest posture, we work on articulation, and lots of people can do mewing and see great results, as is evident on
Right.
various
Yeah.
information pages.
Yeah.
How it works with myofunctional therapy is and the differentiations, and I'm not as familiar, as I say, I'm not as familiar, but I'm not sure how far mewing gets into swallow patterns and correcting a swallow pattern. And I would argue that mewing does actually take lips into account as well, because proper oral rest posture is not, even from a mewing perspective, I wouldn't say that it's considered just the tongue on the roof of the mouth. I would say that it's absolutely lip posture is a huge part of mewing as well.
Right. Yeah.
So, and as you work with mewing, you will build a certain amount of strength in the tongue. But the difference between myofunctional and mewing is we work a lot, I think, from my understanding, is we do work a lot more of a one-on-one perspective and building that strength specific to the client and what the client needs. I may have a client that has a poor oral rest posture but can keep their lips closed. So I'm not going to focus too much on the lip closure as opposed to moving through a program that has more strength building and rest position. So it really depends. But from a mewing perspective, it could work very well for lots of people. Also, from a mewing perspective, I'm not sure how much of the actual physical side of things is necessarily taken into account. As people mew on their own, if they don't feel like they're being successful with it, it's entirely possible that they have a physical structural issue, meaning a tongue tie, or we often call it tethered oral tissues, lip ties, and things like that.
Sure.
That might be something holding a mewing person back too, and that would be ideally recognized by a myofunctional therapist.
Yeah, I hear you. So, and when you said about the lip thing, yeah, it's definitely, lips together, teeth together, tongue on the roof of your mouth for 6 to 8 hours or whatever it is a day. And that's just proper oral posture, right? So it's kind of when people say to me, can I do mewing? Should I do mewing? It's like, yeah, everybody should, because everybody, I think, should be trying to have proper oral posture. It doesn't take that much work, especially once you get used to it. But then once you start to go a little bit further and, if they want to make further improvements to their lip seal, maybe they're mouth breathing at night. Maybe they want to make further improvements to their tongue strength and their tongue posture. Again, someone like you would be able to do a consult or an assessment with them and say, this is what you should work on or could work on. But again, like really, I think that people can sometimes only get so far with mewing. And I think that myofunctional therapy might be something that people could add.
Absolutely.
Yeah.
Again, as a myofunctional therapist, my whole goal is to get a proper oral rest position. And most of the people that come and see me are actually more pain patients than structural patients. But I have a few of both. But my ideal is if you work on getting the muscles of the face to do what they're supposed to do properly, it actually lets go of a lot of other tension in your body. So that's where I look at it from a mewing versus myofunctional therapy perspective, you have somebody one-on-one helping you through that progress, I guess, too.
Yeah, which can be big, because again, like I've been into this stuff for a very long time and I've known about this stuff for a long time, but most of the results I've seen have been in the past like few months, because I started doing the myo and all the stuff that I didn't know before. So yeah, I think that definitely answers that question really well. Now the next thing I wanted to talk about is like, who do you think can do myofunctional therapy? Who do you think should do myofunctional therapy? Because, like I said, the way that I see it is I walk around and I see people's mouths hanging open everywhere I go, right? Anyone who's aware of this stuff really notices how big of a problem it is. But then it's also like, the average person who sits at a desk for 8 hours a day and they might not necessarily have the best oral posture or whatever, can they make improvements? So my question is, who do you think can benefit from myofunctional therapy? If you just look at the layperson, how do you think about that?
Well, I think the majority of people, I look at it as sort of a bigger picture. I think the majority of people, we all tolerate pain differently. We all see ourselves differently. We all see what we look at in the mirror is something that somebody else it looks completely different to somebody else in the mirror.
Yeah.
And my client base is usually more pain management, and then facial structure issues. So TMJ issues or imbalances in facial structure. And that's generally why people find me. From a general perspective, I would say anyone who's not a nasal breather would benefit from myofunctional therapy. So people who are mouth breathers, but somebody who's a mouth breather who's walking down the street and doesn't have any pain or any other issues going on, well, I don't even know if that would happen. Most mouth breathers have some sort of facial discrepancy and some sort of form of what's the word? Some form. Most mouth breathers have these. Most mouth breathers have signs and symptoms of something else going on.
Yeah.
I will say that. I don't know the number on it. I don't have the science behind it, but in my observation, most mouth breathers have allergies. There's something going on here, or there did at some point. So they learned how to breathe through the mouth. So if you're not a nasal breather, you will probably benefit from myofunctional therapy. Okay. So that would be my first sort of immediate reaction. That said, the people that would ideally benefit are people who are going through the orthodontic process and have poor oral tongue rest posture. That the process of using the tongue in a proper orthodontic process, using the tongue to help the orthodontic process or to not impede the orthodontic process. If you have a tongue thrust, closing an open bite is much more difficult if the tongue thrust isn't addressed.
Sure.
And I don't know that you can necessarily address a tongue thrust with just simply by mewing. It will absolutely help. But then if you have a tongue thrust, you may have a tongue tie. So if you don't address it, it's a bigger picture and it's multifactorial. It's not just one thing. So people going through orthodontics would certainly ideally benefit. I mean, I've had clients sit in my chair that I've done a full assessment on, and really they don't have no pain, no swallowing issues. They've a nice full mobile tongue, but they want to go through the process because they're getting relapse on their orthodontic process. They went through ortho and things are moving around, and it's those forces, the fight between the lips and the tongue that aren't ideally balanced. Okay. So I think most people could probably benefit from myofunctional therapy, but it's about understanding how the limits of just one type of therapy, I guess, too. Because it's not. I usually refer people out to body workers. Think postural postural exercises. That's not my scope of practice. I don't do chiropractic therapy. So I generally, my myofunctional practice is more successful if I have other people involved too. So it is usually more than just this right here.
Sure. Yeah.
And it also depends on age. Age is a big factor in the big process too.
So I guess, like, to say, for me, right, I don't have any pain. I kind of come at this from the perspective of, like, I want to improve. Mm-hmm. I read books. I want to improve my intelligence. I work out. I want to improve my physical fitness.
Yes.
So it's kind of like,
what's the motivation for that? It's long term, right?
It's long term.
Exactly the same. So myofunctional therapy, even if you don't have any pain right now, walking around as a mouth breather for 35 years will take its toll. Does that make sense?
Yeah, for sure, 100%.
So, because what happens is there's so many ramifications with mouth breathing, and then the oral ramifications in terms of disease and decay and just the sheer movement of, we used to call it mesial drift, meaning everything went like this as you get older and you get more crowding.
But you see all the time. Yeah, you see all the time.
And then
the question is, why does a lot of the elderly population kind of, have that slumped over and face falling? And you see it. Yeah. You definitely see it.
And it's there's lots of research in this, and I'm not quoting any, but it's a generational thing. There's lots of science and information on the advent of sugars and what have you, that sugars and industrialized food and that all started to change, and the way we chew food and the way we build muscle and the way we build the structure.
Hey, I've done videos on
Yeah.
this.
Yeah, of course.
Dr. Mew says in the book Jaws that we use our muscles of mastication 3% as much as the hunter-gatherer ancestors. So
And they
I
all had all
definitely,
their teeth and big, beautiful jaws.
yeah, I know. And it's good that to spread awareness, which is kind of why I'm doing this. But again, like, so I look at it from two perspectives, right? You generally look at it from a pain and treatment and prevention perspective because you're a medical professional. Me, I look at it from the perspective of I want to be better. I want to, you know, if I can, I want to look better. I want to be healthier. You know, I want to have better posture. I want to breathe better. And those are all things that this has allowed me and will continue to do for me, I know, in the future. And for me, there's a big balance, of course, because I know a lot of people really go down the rabbit hole of like thinking about this stuff all the time. And again, while it's not of that much importance, like I said, I care about reading books. I care about my fitness. I don't think about reading books and stuff all the time. But just like this, that's why I honestly really like myofunctional therapy, because you don't need to think about it. You just do the exercises to make the improvements, and kind of get along on with your life. But how do you think about it from the perspective of someone like me or someone watching this channel who's thinking, oh yeah, you know, I'd like to improve a little bit. If I could get some changes to my facial structure over time, if I can breathe a little better, if I can improve my posture, that's worth it.
It's a hard question for me to answer.
Yeah.
Because from my perspective, if somebody doesn't have a problem, why seek out to fix it? But it really comes back to if you're somebody who understands that you have poor oral rest and your poor oral rest posture, myofunctional therapy is something that would benefit you. And having somebody physically looking in your mouth, physically assessing the possible physical limitations of what your oral functions are.
Yeah,
If that makes sense.
yeah,
So because a lot of people don't realize they can improve even more.
for sure. Like if they have a tongue, like I have a posterior tongue tie, for example, which I never knew. But again, like, so the last thing I wanted to talk about was kind of, so again, like you look at it from a pain or helping a patient with a problem, or like you said, a preventative kind of lens, whereby, like, you know, we're either fixing or preventing a problem. And again, what I was saying is the way that I kind of think about this is that I think about it the same as me going to the gym. It's like improving my posture, improving my tongue posture, you know, anything that is going to make me better over time. And if it's something that I can do in 10 minutes per day, it's going to help me breathe better. It's going to potentially help me look better in the future. Then it's kind of like I see no downside in doing it, which is why I wanted to do this video for my audience too. So how do you think about that? How do you think about someone coming to you and kind of saying, like, I want to make improvements?
Well, I would do an assessment and tell them what I see. And then I will say that most people have something to improve upon.
Yeah.
I mean, really what it comes down to. And I mean, even if you're happy with everything structurally in your face and everything's comfortable and you've been through the process and you have a nice, wide, beautiful arch, if you have poor posture, poor oral rest posture, or if anything changes over at all, you'll lose that moving forward.
Yeah.
So it's really what you're talking about. You could be absolutely perfect, and then something changes for some reason, and you want to have it's good to have the understanding of what ideal is, I guess, for future. It is, when you talk about it like that, it really is a concept of preventative measures.
Sure.
And yes, you can. Everybody's different. Everybody's bones are different. Everybody's process is different. So from a structural perspective, if somebody wants to improve their overall looks, myo can do that, and myo tones things and tones tissue, and it can actually do that over time, and then it maintains it because you
Right.
know what you need to do.
Yeah.
Does
Yeah.
that
And
make
so, like I
sense?
said, the way I think about this is like, it's something that is a way that I can improve, but I also don't, I don't like we've talked about this before. The thing that I don't like about, the mewing community, and I think it's great that everybody wants to make improvements, but I really don't like this thing of like the perfect face, or like the ideal golden ratio, and all this stuff, because I just don't think it's uh, a good thing for people to think about, that they need to be perfect, when in reality it really doesn't make that much of a difference. So that's why I kind of, again, that's what I like about Maya, because it's like, rather than, thinking about it all the time, and doing all these self-assessments and stuff, it's just, you can just have someone tell you what to do to improve. If you can make some improvements, great. And that's kind of how I think of it.
Hmm.
Yeah.
I commonly talk about excellence, not perfection. I have lots of clients that are uh, that you know have facial asymmetries, and again, that's not something that myofunctional therapy is necessarily going to pan out for them. Doesn't mean it won't, and it
It
doesn't mean
can,
it
yeah.
won't help it.
Right.
But it's not something that absolutely will change. And especially,
Yeah.
as I said earlier, age has a huge factor, plays a huge factor in this. Um, you'll have that good, nice golden ratio and that beautiful face if this is intervened when you're
Younger.
really small. So coming to myofunctional as a um, sorry, my computer. Coming to myofunctional therapy as an adult, any kind of structural changes or face changes that you might want to see, it's going to take a long time. And I'm pretty honest with my clients. I mean, sometimes it may not happen without the intervention of some sort of orthodontic or orthotropic appliances,
Yeah.
because you're at a point where things, I mean, bone is movable, bone is malleable, it changes over time
Yeah.
based on forces that are put on it. So can you get a nice flat beautiful palate with your tongue up there, learning how to put your tongue up there all the time? Yes, eventually, possibly, but it takes a long time as
Hmm.
an adult. So you might want to have an orthodontic intervention of some sort.
Yeah. Yeah.
So
Makes sense.
that's where I come from. I come from an excellence, not necessarily perfection perspective.
Mm. Yeah. Okay. Well, yeah, I think that's basically all I wanted to cover. There's obviously a lot of other stuff that we could talk about in terms of specifics, but I think this is good to give people a general overview of kind of what Myo is, and if they can benefit from it.
Sure.
And so, yeah, that's good. And you helped us obviously with Dr. Estrabilo with
Yeah.
our program, which was great, and people love that. So, for you guys, I'll put on the screen and in the description for that program if you want to register. Also, if they want to do a consult with you, Joe, how can they get in touch with you?
So right now, due to our current sort of world situation, I'm doing all my consults and all my sessions online. But you can visit, I have a site, it's myotherapyinthegta.ca. You can also reach me through my clinic, which is kingsmilldentalhygiene.ca. And then we just go from there. My assessments are about 90 minutes long, and then we sort of go from there. Everybody's treatment is very different, so I can't say it's going to be this many sessions or anything like that. It really does depend on the assessment.
Right. So yeah,
Yeah,
so I'll put that information in case anyone wants to have a consult with you.
for sure.
Again, like one of the things that I like about you, Joe, and this is what I've told to people as well, is that, I'm just gonna, say this in my best way I can say it, is that you won't BS people. you know, because like you said, like you look at someone and you're going to be realistic with them in terms of what they want, what they can improve, what their potential impediments are.
Hmm.
And so that's why I do recommend a lot of people to go see you. So
Yeah,
yeah.
I think it really comes down to there's no one answer for all of it, and understanding. I certainly understand my limitations in my scope of practice, and I'm a big fan of interdisciplinary work. And if if there's a set goal that somebody wants to achieve, and I'm not going to, I can't do that, they're going to know that I can't do that.
Yeah, like if like they might need an expansion or they might need
Yeah,
to do ortho. Yeah,
or you've got this shoulder hangs lower. We need to see a chiropractor or see an osteopath, or there's other factors. And again, myofunctional therapy will improve posture and be great along with postural programs, but it won't. I'm a big advocate of not one person can fix everything.
totally. Yeah, and that's kind of what Dr. Estrobilo's program is about too, right? It's like you do the posture and the tongue, the myo, the tongue, and again, they may need to see another professional, but yeah. So, but thank you very much for doing this call
No
with us.
problem. No problem.
Yeah, and take care.
Wonderful. Thanks very much.